Well, welcome MDC family. This evening we have Steve Gledhill come to chat to us about prostate cancer and black men. Because as you know, men a bit funny about the prostate area, especially black men. You have the floor, Steve.
You can now see this, can you?
We can indeed.
Yeah.
And you can see me, see my name.
Can see, yep.
So you know how to spell my name and you know what the date is today. So that's a good start, isn't it?
Just in case.
So how many of you guys are there? Is it just the three of you or any more?
I think we've got 6 at the moment.
Okay, not to worry.
Including you.
Right, well, let's begin at the beginning. You can all hear me then, can you?
Hear you loud and clear, bro.
Right. Well, I'm Steve Gledhill, as you can see from that. I'm talking to you from Harpenden, which is a little bit south of Luton, between Luton and St Albans, in case you're not entirely sure your geography. And why am I talking to you guys? Well, the reason I'm talking to you guys is that about 10 years ago, I went to see my doctor and I said, I'm about 50 or more than 50. And I'd heard a story that at that sort of age, men get prostate cancer. And I knew nothing about it, and we talked about it. And he gave me a test, and here am I, 10 plus years later, having been identified with prostate cancer and been treated, and I'm alive. Now, if I hadn't had that talk with my GP, I might not be alive today. And the reason being is that firstly, there are no symptoms. So I didn't really know. It was just a strange idea that I had from somebody talking to me in a pub some ages ago about prostate cancer. And also there was no family history, which is often the way. And so here we are. And I, having been cured of it, which is quite, I'll go through the story later, I joined the Prostate Cancer UK charity with the idea of passing on my life story to others. And fairly soon after I joined the Prostate Cancer UK and they trained me and gave me a set of slides, I got invited to the Caribbean Cricket Club in Luton. And I gave a talk there and I got invited to other things. Actually, what was the name of the where we met in Luton last?
Men's International Day.
International Day. Well, yeah, I must have done about 5 or 6 international days, and I got to know a lot of you guys. I got invited onto Luton Urban Radio, and actually, when I think of Luton Urban Radio, the host there phoned me up one day and said, "Hey, Steve, I finally listened to you." and I went to see the doctor. And I'm going to the Leicester Hospital next week because they're going to operate on me. And later in the week, I got another phone call from him and he said, "Can you please come up to the hospital? And I want to thank you in front of the consultant and my other patients for saving my life." And I said, "What's that? What do you mean I saved your life?" I said, "I listened to you. I took your advice. I got tested. And if it hadn't been for you, I might be dead too." So that's a serious, serious subject.
Mm-hmm.
And the reason being, the important thing is for you guys to listen to is, and you'll see it again later, and this is an extraordinary statistic. Listen to this. 1 in 4 black men get prostate cancer. 1 in 8 white men do. Now, I don't know, and nobody knows why it's the difference. But if you've got 4 people on the screen tonight, 1 of you will get it.
1 in 4.
It's treatable, but it's treatable only if you get diagnosed early and you take all the sensible precautions. But anyway, let's go through the formal bit. And this is Yes, serious. One man dies from prostate cancer every hour of every day. And it's the most common male cancer in the UK because it only happens on males, as we'll see in a minute. There's 300,000 men are living with and after prostate cancer in the UK, so it's huge. Well, you might be saying to yourself, and as I didn't know anything about the prostate when I was first talking to my GP. And the question is, where is the prostate? Well, here we are. It's down below in an area where perhaps we don't usually talk about. We know where the bladder is. We know where the willy is, the penis. It's just below there. It's just a tiny little thing. You can see it there. So what is a prostate? Only men have a prostate. It's a gland, and that's this bit here. Its main job is to help make semen, so you can understand why it's only for men. A tiny little thing, really, because people get asked, so how big is a prostate? An orange, no. Walnut, yes, it's about the size of a walnut. But that walnut, if it gets prostate infection or the cancerous infection, it can kill you. As simple as that. But other things can go wrong, and I think we'll just go through this quickly. You can have an enlarged prostate, but it doesn't give you cancer, so it doesn't kill you, but it just needs to be checked out. Secondly, is a thing called prostatitis. It's an inflammation or infection of the prostate, and it's most common in younger and middle-aged men, typical between 30 and 50. It's not the same as prostate cancer, but again, it's a thing that needs to be tested. But what we're here tonight to talk about is the prostate cancer. And cancer, as you probably know, it can develop when cells start to grow in an uncontrolled way. And it's a weird thing, and it's a bit frightening because it can just creep up on you. But if you get cancerous growth in the prostate gland, prostate cancer can develop. But this is the frightening thing. Most men with early stage prostate cancer have no symptoms at all. So how on earth do you know that you've got this cancer which could kill you? Simple as that. So the question is, are you at risk? Well, I don't think I've already told you this. 1 in 8 men will get prostate cancer at some point in their lives. But chaps, I know my audience, if you're black, you're at double the risk. 1 in 4 black men will get prostate cancer. And I think I said earlier, nobody knows why, but it's true. It's what happens. And I think if there's one thing that you need to remember as you go home, is to remember this stark thing. But then you're beginning to possibly get a bit frightened. Why the hell? Or what the hell can I do about it? Well, the answer is you can do a lot about it by taking control. Now, we're just counting a bit more. Prostate cancer mainly affects men over the age of 50. So if you're under 50, you're unlikely to get prostate cancer. But you probably know lots of other people, your father or uncle or friends that are over 50, and you might like to pass this message on to them. And after the age of 50, your risk increases as you get older. So I was in my mid-50s when I was diagnosed. But this is an interesting other thing. If you're 2.5 times more likely to get prostate cancer if your father or brother has had it. So it goes in the family.
You hear it.
Yeah. And on top of that, and it's only recently been found out, if your mother or sister has had breast cancer, you're more likely to get it. It's so strange. It goes through the mother's line, even though it's a male disease. And it's particularly if they were diagnosed under the age of 60. So don't ask me, I'm not a doctor, but that is the truth and the fact, and that's what the statistics tell us. So the situation we're on now is that I've scared the hell out of you. And if you're over 50 and you're black, chances are you'll get prostate cancer. But like me, I took action, and thank God that I did, and I mean that sincerely, because without having listened to all these things in my head, I wouldn't have confronted my GP and said, what do I do about it? Because I had no family illnesses, and I had no symptoms, because you don't get symptoms. So you're wondering, say, I think I'm at risk, or I might have a problem. And you are at risk, because if you're black, and you're 1 in 4 chance of getting a risk. So every man has got a risk of getting it. So you should take action. But the first thing is to speak to your GP. And I know it's difficult at the moment, but most people can get a GP appointment within 2 or 3 weeks. So don't get put off, because you're not going to die instantly. But in my case, it took over a year from diagnosis to having it sorted, because it doesn't sort of leap up on you, but it's there. Anyway, the next thing it says on the screen is your GP can do a few tests to find out if you have a prostate problem. And the doctor will explain the pros and cons of the test, because it's not entirely simple, because the test, we'll come on to it in a second, but I'll mention it. I think it's called a PSA test, which you might have heard of, the prostate specific antigen. And people get worried about diagnosis of prostate cancer. But the PSA test is a simple blood test. It's just a simple needle taking a sample of blood, as you do for any blood test, and that gets sent off to the laboratory, and they find out whether it's worth investigating more or you're okay. But it does here say there's no single test to diagnose prostate cancer. And one of the reasons why prostate cancer charities and medical organizations need money is to find out a simple test which will work. Because as you probably know, for women, they get breast cancer testing. And every woman over the age of, I don't know what, gets an invitation to having breast cancer testing. And they also get tests for their other bits down below. But men don't. And the reason they don't is there's not a reliable one test, the whole load of tests. I had scans and bone tests, goodness knows what. Anyway, these are the sort of tests that you can carry out as a urine test. That's simple. You just pee into a jar and they check that your problems aren't a urine infection. There is the PSA test, which I've just referred to, and it measures the amount of prostate-specific antigen, or the PSA, in your blood. As I say, it's just a simple prick in your arm, and they take a sample of blood. And I know that some people are worried about that, but goodness me, a tiny prick of a needle in your arm could save your life. It's worth remembering. So if you get what they call a raised PSA level, because they have these scientific levels that they show you, but they'll show you've got a problem with your prostate, but not necessarily prostate cancer. So let's go back to a little bit more science. There's one other thing you can do, and this is where men get a little bit silly and sometimes laugh about. It's called the finger up the bum. Stephen Fry, for example, did some stupid comedy skits about it. But it's actually a very simple and painless way of finding out, alternatively, whether you've got a prostate problem. And there's simply, you can see from the diagram here, that's your bum. They just put a finger up there and you can feel the prostate. And it's, if it's got lumps and things on it, that's another way of finding it. So your doctor, he will put a rubber glove on, you'll be pleased to know. And off he goes, just puts a finger there with a bit of cream on there, and can feel it with the hard bumpy areas may suggest prostate cancer. So what I'm indicating there is a blood test and a finger up the bum are two very simple and painless and straightforward ways of indicating whether or not you might be dying of prostate cancer. And I don't want to be dramatic about it, but chaps, that's the real life. Now, some people say that you can't get a PSA test and the doctors turn you down. In fact, I have to confess, in my case, the doctor turned me down because he said I was too young and there was no family history and I didn't have any symptoms. So I looked him straight in the eye and said, I want a test. He said, all right. But not everybody actually has got the balls to confront a doctor and say, I want it and you're wrong. But sometimes you have to in this life. And I think that was one of the reasons. I remember that the rest of my life is that confrontation with my GP is probably why I'm talking to you now, because I might have just walked away. But that's no longer the situation, please to know. The situation has changed, and it's now that you have the right to have a PSA test if you're over 50 and you've talked about it with your doctor. So it's not a confrontational issue anymore, but over 50, irrespective of whether you've got any symptoms, especially if you've got any family problems or family history, and especially, as I've told you 2 or 3 times, and I don't know why, but it's true, if you're black, there's a 1 in 4 chance. So at the age of 50, get tested. It's as simple as that. So it's a very simple message I'm giving you guys, and I'll take a long time to explain it. But if you want some more information, the Prostate Cancer UK, I haven't sadly actually got their URL on the screen, but just go into Google, Prostate Cancer UK. They have a tremendous amount of literature. There's, for example, a booklet here, Prostate Cancer and Other Prostate Problems, Information for Black Men. It's about a 30-page booklet, and if you contact them over the internet, they'll either send you a PDF file or send you a real paper book. There's another one here, A Guide to Common Prostate Problems. There's another one which is a fold-out, I call it a Z-fold book, about the size of a credit card, where they've got pages, and there's a specific for black men because they've changed their emphasis from the sort of white population to where the biggest risk is. And this is the book. You open it up and it's got really most of the slideshow here. And it says, what is it? What is the prostate? You can see that same slide. What is prostate cancer? I don't have symptoms when I was diagnosed with prostate cancer. I went to see my GP because a friend was diagnosed and told me that black men have an increased risk. Well, that's important. So 1 in 4 again. Well, actually here they say 45 plus. They keep changing the goalposts. But in fact, if you're 45 and over, you need to get tested. And also here, there also says if you're overweight or obese, you might have a higher risk of being diagnosed. So if you're like me, you're wonderfully slim and do lots of exercise, or maybe I don't, but yeah, that can help too. And here it says, is there anything I can do to prevent prostate cancer? And it says, no one knows how to prevent prostate cancer, but staying healthy weight, for example, eating healthily can help. But if you've got it, that's not going to help anybody because you're there. But then it says, what should I do next? If you're a black man and you're over 45, speak to your GP about your risk. And they will listen to your concerns and talk to you about it. The PSA test. So really, this is going back everything that was on my slides, but it's all wonderfully in this booklet, which you can get from Prostate Cancer UK. The digital rectal examination I talked about. And it says if you're worried about going to see a GP, some men feel worried or embarrassed about having tests. Well, you probably don't like a doctor, particularly a female doctor, because they carry out these tests too. But my argument is, if you're worried about it, what would you rather have? Being embarrassed in front of a doctor or being carried out on a stretcher in the mortuary. I mean, frankly, that's what it's all about. So I don't want to be a miserable bastard. Well, I am actually. So this is where we get at the end. And I think you've got the message. I'm sure you have. But here, in summary, often there are no symptoms. So don't wait until you feel these things, because you won't get them. You could be well on your way in advanced prostate cancer before you get any symptoms. Or you might have no symptoms at all. There's no automatic screening, so don't sit back and wait for somebody to call you and say, hey, it's your turn to get prostate cancer test. Not going to happen. It's up to you to go to the GP and start it off. That's why I say it's up to you, and speak to your GP before it's too late. And then frankly, at the end, you can remember this, just get tested. It's your responsibility, or you could die young. And I say these quite sincerely to you guys, because you're all members of the human race. It's just my way of sharing the problem with you and showing what you could possibly prevent you from dying prematurely. So that's it, chaps. Simple as that. But I wish you well.
Cheers. Thank you, Steve.
Thank you.
Yeah, it's a nice presentation.
Okay.
Thanks, Steve.
You just click stop share at the top.
I'll do that. Thank you for reminding me.
Yeah, always.
I can see all of your lovely face now.
So, 1 in 4 black men.
Yeah.
Could this have anything to do with increased sexuality, sexual activity?
No, I don't think it is at all. It's not like AIDS or anything like that. No.
No, it's not like an AIDS or nothing. Like you don't catch something, but I mean the actual activity itself. Because I think 1 in 4 black men, I'm like, black men, they like their sex, innit? So, you know what I mean? We like to do our thing. So, wondering if there was
You know, white men enjoy their sex too, mate.
Yeah, well, okay. Yeah, I don't do that. Oh, yeah, cheers. Thanks for that. Yeah, cheers.
No, it's not. No, it's a good question. I've never heard it, and I've been in front of lots of audiences and lots of hundreds of people. No, I don't think it is at all. It's something that is not being. No medical professionals have worked out why black men get it more often. In fact, nobody knows why that tiny little prostate down there under your bladder. Why this thing the size of a walnut should be such a killer. But that's the fact of the matter. I think that's the answer.
Yeah, and I see you said something about the weight gain as well, overweight and not living healthy.
Well, I think that applies to all illnesses, really. But it's probably just a check for everybody to realise that by staying healthy in weight, diet, not drinking too much and what have you. But of course, those are all the things that I do wrong.
All right. Mark, you had a question? Your mic's off, Mark.
Who's got the question there then?
Sorry, yeah, it's me, Steve.
Okay.
Do you think one of the main issues with the black men? Well, no, I'm comparing. Are black men more likely to be diagnosed later than white men? So would you say black men are more reluctant to come forward? And that's probably
I don't think the age is a difference, but that's a good question. But I think you are right, and I don't want to be rude, but I can give you a little story. 3 or 4 years ago, I went to Brixton with the head of the Prostate Cancer charity, and we gave a similar talk to this, and we were opening up a clinic in Brixton. And I remember this black woman come up to me. She said, "You know what? Our men are cowards. They don't want to get tested. They don't want a needle in them." And I said, "That's crazy." And they said, "Well, no, they don't really." And I think that is, and I don't want to insult you at all, but there is a reluctance about getting a needle stuck in you or a finger up the bum. And part of my message is Don't be worried about it. Don't be ashamed about it. It was not going to hurt, and off you go. But I'm not sure if that's a good answer, but it's an answer.
I think black men are quite reluctant in all areas when it comes to the doctors and all that, and GP. What are you saying, man?
Well, I can't answer that myself because I don't have the privilege of being a black man. But yeah, what's the reason that you say that then?
No, just in general, I think black men
I,
are like,
I was just sort of weighing up like the statistics. Are we more reluctant to come forward and have the tests more than people from other races? Maybe I'm just putting it out there, really. I
think it's. I think sadly, black people will get prostate cancer more frequently, irrespective of what they do. That's my understanding of it. But I could be a bit wrong, and you might be onto something that because they don't get tested, so when they should do, they're going to get it more. But I think it all contributes to it. But in the end of it, the answer is, I say it bluntly, bloody well go and get tested.
So when it comes to the testing, so is it more like the blood test first and then the PCR, or is it?
Well, in my situation, it was that the doctor firstly did the finger up the bum because that's the quick one they can do there and then in the surgery within minutes.
Yeah.
And then he said, right, well, I think you've got a problem. Off you go and get a blood test. So they put me into the phlebotomy clinic, which is the blood test clinic. And then I went to the hospital, and then they got me to pee into a jar. And then I ended up with an MRI scan and a bone scan. There's a whole lot of stuff, but that gives you the idea of the sequence, because you can't just say you've got it or you haven't.
So it's either then, Steve, like the blood test or the other test is one. Is yours.
No, what I was hoping I was trying to say was that all of these happen. There's a sequence of tests.
Oh, okay.
And one of the reasons why they do that, because there are lots of different ways of treating prostate cancer, which we haven't got onto, which was perhaps I could just talk about that briefly now, because in my situation, the first thing they did was to give me hormone tab, slightly embarrassing because they reduced the male testosterone. Your breasts get enlarged like a woman and what have you. But the reason they did that was to shrink the size of the prostate, going on to the next stage where I had radiotherapy. And I went to Mount Vernon Hospital 5 days a week for 6 weeks to having radiography, where they essentially get you to lie down on a couch in a lead-lined room. Everybody disappears, and they focus this radio beam inside, well, where you can imagine. And, so that was the next aspect, and so that was radiography. And then there's a thing called brachytherapy, where they also put pipes up inside and squirt radioactive elements inside you to attack the cancer from inside. And that sounds complicated, but shit, that's a damn sight better than dying. Yeah. My sister, actually, who worked at Mount Vernon at one stage, she said, you know what, you could have bought a house with that treatment, about £500,000 worth of treatment for the radiography over those 6 weeks every day. So that's, but why I said that is that all these diagnoses with scans and things, they work out which particular treatment there can be, because there are other treatments like surgery where they remove the prostate, but there's a risk on that because the cancerous cells can spill out to the rest of the body. There are other things they can do. So,
can I just quickly ask? Sorry to interject.
No, no, please do.
So which test is more accurate? I mean, so you got the urine test, blood test, and the DRE, the finger test.
Which is right. That I think the answer to that is that they're slowly becoming. It's slowly becoming more obvious how big the problem is. Does that make sense? Probably doesn't really.
I mean, if they say to you, "Oh, you can come and test," you can just say, "Oh, can I just do the urine testing or the blood test?" Say that man wants to try and avoid the finger, basically.
Oh, for crying out loud.
No, I'm just saying. I'm just asking. Which
Sorry,
one's more accurate?
I didn't quite catch your last comment there.
No, I was just saying which one is more accurate if someone was trying to actually avoid the finger test. Then
I think
you
that
just say the urine or the blood test.
I think they're becoming increasingly more accurate. If the
Okay.
first two, there's nothing, then they'll say go away. You know,
All right,
don't
okay.
worry. But then they want to find out more and more how bad it is. You know, and in my situation, I forget what the name of the test is. I should have written it down, but I was 8 out of 10 out of one of the tests. So that was pretty acute,
Right,
which was surprising for a man of my age at that time.
right.
Again, it didn't answer your question, but it gives you some insight into it. So, I think the answer to that, I think the best thing to say at this stage is that listen to your doctor. You go and see your GP, and they'll give you
Okay.
a pathway along the way. I ended up going to Hemel Hempstead hospitals. I went to Luton and Dunstable Hospital. I went to Mount Vernon Hospital, and I went to Hemel Hempstead for some more scan tests. And
Right.
the guys that know best, and you just have to lie back and say, "Look, I don't know. Yeah, here it is. You guys tell me what I need to do."
I'll lie back and think of England, yeah?
Oh, well, that as well.
All right. Blacks, you got a question?
Yes, thank you, Steve, for that presentation. It's cool. I had an introduction to getting myself screened through Tony Jules. I don't know if you met him.
Don't know the name. Sorry, no.
Okay, cool. Well, he's very outspoken on getting self-tested. He got prostate cancer. He died a few years after that. He raised a lot of money at the hospice for it. And so he obviously got into the media, and they renamed a part of a new building in Marsh Farm,
Yeah.
where he was based, after him, because of his raising of funds and stuff.
What's his name again? Sorry.
Tony Jules.
Okay.
Yeah. So my question is, once you get tested, should you get retested every 3 years or 6 years or something like that?
That's a very good question. I get retested every year still, and I will
Okay.
do until the end of my life just to test. I'm not qualified to answer that. I don't think. I think you should just get the advice of your doctor.
Okay.
I think it depends how high you are up the scale. And if you're low in the scale, he might say come back in 5 years. If you're fairly high, because actually what I can say here is there's an expression known as watchful waiting, and that's a medical expression, watchful waiting, where they just sort of say, well, off you go, and we're not going to do anything now, and we will wait, and we will test you, and they will say X number of years. But it's
Okay.
yeah, okay.
So is that you can send off a DNA sample and find out what foods make you sicker or what foods will make you stronger. Immune system therapy, hormones therapy, blah blah. Do you recommend that? To
I
send
don't
off your
know anything
DNA?
about it, I'm afraid.
Okay.
I'm not qualified to give an answer. One of the important things about being a volunteer with the prostate cancer charity is that I think I already mentioned I'm not medically qualified, and I shouldn't make any comment about things that I don't know. So, I'm sorry, but there we are. But that's honest.
Yeah, that's absolutely brilliant. I personally have a problem with men who have a problem with getting tested.
Yes.
If there's 4 tests, take them all. You're only going to get tested once, because then they're going to find out or you're not. They're going to find out you are, or they're going to find out you're not. But you've done it once, and then that's fine. So I was wondering if I have to do it every 3 years, that might be a problem. Or
Well,
every couple of weeks.
No, not every couple of weeks. No. No, it's actually a fairly slow, progressive thing. As I said, it was about a year from when I was first got a hint of it before they finally did the radiography. So you don't need to panic, but you do need to take action. And
yeah.
But it's as simple as that. Go and talk to a GP, and I get him boring because I'm saying the same old bloody thing.
Well, I keep saying it till he gets in.
Yeah, I agree.
Because like if it's, you don't know if you've got it or not because there's no symptoms. So go and get tested, and get tested in 4 different ways.
Make sure get
4 different
tested.
ways. Why don't they just get one? If it's it's not obvious you got it, even if you get 1 test, get 4 tests to make sure you haven't got it.
Well, all I can say is I wish that everybody was as sensible as you, mate.
Yeah, I agree. You should get tested. Mark, you got a question?
Question somewhere?
Yeah, Mark's got a question.
Yeah, hi Steve. Yeah, I was wondering, is there like any possibility where they could actually do sort of like these PCR tests in the community?
PSA, actually, just to be
PSA. Sorry, I keep saying it wrong. Yeah, is there an opportunity of like, so you know, people are reluctant to go to the doctors, if there was sort of like a community event set up where people sort of over 50 could go and have the blood test done?
Well, that's absolutely that's a brilliant question, because some communities do it. One of the guys that I got to meet on the training course with prostate cancer, when we got our briefing, he's in Reading, and he belongs to the Lions Club in Reading, and they pay for a mass screening.
Yeah.
But there's a lot of controversy about that. It's a great thing. I've got a PSA test, and that's my value, but there's no follow-up necessarily, and so there is a feeling that it's good to at least get some idea whether you might have it, but then what you do next, you're sort of left in the wilderness. And I'm not sufficiently in touch at the moment, because this was about 2 or 3 years ago, as to what the current status is. But I think, because the problem with the PSA test is that it gives an indication of where you might be going, but it doesn't tell you what your destination is. So mass screenings probably have their place, but there's no substitute, I think, from going to your GP and having a face-to-face, one-to-one discussion with them.
Can I do a little quick follow-up question? You know, please.
Hold on, Blacks. We've got some more hands up still. Let me just go through them first, yeah, and get back to you.
That's Sydney, is it?
Sydney, you got your hand up.
Yeah. I was lucky enough for my GP to offer me a blood test a few weeks back, and I went for it, and it came back all clear. So in that regard, I was quite happy with that. But I mean, are you saying that I should go and ask for a follow-up test?
Well, what did your GP say?
I said it was good. There's nothing to worry about. My levels weren't elevated.
Well, that's a good thing. Answer is I don't know, but maybe in a year's time, go back to your GP and try again.
Yeah. Keep
trying. But I'm a bit surprised that he didn't say, well, come back sometime in the future, or I mean, if it was extremely low, then he might say come back in 5 years. But if it was halfway up the scale, he might say come back in 2 years. So,
well, according to what they said, they said it was normal. They said it was normal.
Yeah.
So they didn't have any signs for concern.
Well, I'll just repeat the old thing. I'm sorry to hear it again. It's up to you.
So I mean,
you just
so
need to
what
go
do you
back.
say?
after
year
a
from
year
now?
or so, give it a go again.
Okay.
But,
Sorry. The next question I had was exercises. Can we? Are there exercises that we can do that are particularly targeted to that area? Are there things that we can do that would help mitigate this problem?
well, there have been lots and lots and lots of things. People saying you should eat lots of tomatoes.
No.
Even getting, but if if everybody out there relied on eating lots of tomatoes to save their life, then I think I'm going to be worried. And I think exercise helps, and general fitness helps everything. So I think that's all I can say there. But I know of no specific thing you can do to not get prostate cancer.
Okay.
Oh, thank you.
Mark, you got your hand up? Go ahead. You there, Mark?
I don't see anybody.
Oh no, he's not there. Okay.
Yeah, I've got a question. I've got a comment.
Yeah, go ahead, Blaps.
On the last one, that what can we do? It's I've heard there's an exercise. I do it a lot, but it's because I've talked to a lot of people about this, and I'm interested, and I'll make sure I haven't got it. It's like when you're urinating, you try to stop yourself, cut it off while it's mid flow.
I've heard of that.
Yeah, to strengthen
Strengthen
the
some.
sphincter
Yeah, I've heard of that.
that surrounds the prostate.
Mm.
So I've heard that's a thing, and about the tomatoes thing. Tomatoes are not good for you. The skin of tomatoes has lectins in it, which causes scarring inside your gut, and then leads to bringing
Well,
on
I would agree
inflammation
with that.
in the mucus.
It's extremely controversial, and I perhaps shouldn't have mentioned it, but you do hear lots of these sort of slightly quack remedies, if you can use the expression without offending anyone.
I'm not a duck. It's cool.
You're not a duck.
I'm not a duck. Only on Saturdays I'm a duck. I get with Webby. But,
Right.
yeah, I understand what you're saying. It's a difficult one because I asked Tony before, since years. He was walking around fine. He's just saying that he's got diagnosed, he might have it, and then 3 years later he had it, and that was it. So he was telling me, I was asking him, how do you feel? Did you feel more tired, or did you feel weaker? You must have met other people like yourself. You must have met a lot of people that have had it and then had the operation and they're fine later. Did they? Isn't there a collective
Conglomerate.
feeling that you all had when you had it? Like, I felt more tired at the time. And then after the operation, I felt elevated. I was much more healthier. I was off my food. I had headaches. Anything. Was there anything that was different?
Well, that's a good point. But actually, the only time I felt ill was when I was being treated.
Yeah, that can cause.
Crazy, because when I was doing this radiotherapy, it was 6 weeks of it every day in the week.
Yeah.
And it was about 11 o'clock in the morning. And I'd drive up to Mount Vernon, which is near Rickmansworth area. And I would come back in the evening, in the afternoons, and it would progressively, week after week, I would just fall asleep. But that's not the prostate cancer. That's the treatment with this radiotherapy, which is a fairly aggressive thing with this huge machine. But that was what was curing me.
Can that cause incontinence as well?
No, it didn't actually, I don't think.
No, but can it? I'm saying, I'm just.
Has
it happened to anyone?
I haven't heard of that mentioned.
Okay.
What it can do, and we haven't touched upon this because this might frighten the rest of you.
Scare them.
Scare the hell out of you. No, one of the side effects of the treatment is that you can find it difficult to have an erection. Let's put it like that.
Lose your prowess.
So your sex life might not be so good, but then my argument is, would you rather have a sex life or would you be dead? And was there? It sounds a bit crude question. So
Yeah, they would have missed me, man.
eh?
The girls would miss me.
Oh, they were sure they would. They miss you if you were dead, and they miss
Yeah,
you
you know that.
in another direction. But you have to confront these things, and that's where it is, because the radiation is, well, as the treatment gets better and it's more
So
direct.
that's the treatment, radiation.
Not necessarily, no. And that's the strange thing is, I've met a number of people through follow-up groups and the charity have support groups that I go to, and I've had radiotherapy and brachytherapy, and others had another form of brachytherapy where they inject beads into the stomach, into the thing, and they have surgery and what have you. So there are so many different ways of doing it, depending on the precise diagnosis of where you are.
So if it's such a serious situation, and I mean cancer is, why do they not do the checks on men? Like you said with women, they get notified by the GP to come in and get yourself checked.
Well, the reason, as I understand it, is simply is that the PSA tests and the other tests aren't accurate enough.
That's the urine and the blood test.
Well, it's the PSA really is the one. Yeah, the blood test, the PSA. If there was a test that would accurately say that's your problem, they would do it. But I don't fully understand the argument, to be honest. But that is the argument, and I keep reading it. And they're looking for a test, a single test, which is very reliable and won't waste people's time.
Right.
But yeah, it'd be wonderful if it existed.
Yeah, I think what could usher people into getting a test would be to document. I mean, watching Tony Jules waste away within 6 months of looking quite healthy down to a frail, small person. He was a robust person when he was fine, and then a few like when it caught on and he got it, he's like, if you want stage 4, if you can, equate it. Yeah, he just deteriorated really quickly, and there's loads of pictures online of his deterioration, and there's obviously videos of him chatting when he was healthy and when he was ill with it, but there's no time frame on that. It's just, oh, you think it might have taken 10 years, but it was actually a very short space of time. If people understood how quickly it grasps from when you get diagnosed to when you get it, I think it would usher people faster.
Yeah, actually, that's a good point. I've been meaning to mention this. There's a very good friend of mine, a colleague. I used to work at Marconi in St Albans, and there was a very good friend and colleague from there who lived in Sandring, named Ken Fuchs. And we used to have regular drinks in the pub at the Green Man in Sandring, would you believe? And one day he realised that I'd had some prostate cancer tests, and he was a bit older than me, so I said, "Haven't you been done?" He said, "No, I don't want to do it. Can't be bothered." And I said, "Go on, you bloody idiot, do it." And eventually he did, about a year later. And he was treated by the same consultant as me at Mount Vernon. And he was dead within 2 years because he left it that little bit too late.
Okay.
And he just wasted away. And I actually still, one of the most vivid memories of my life was giving the eulogy in the parish church in Sandridge, standing up in the pulpit. I've never done before. Pretty frightening, actually. With the church completely full of people sitting on the floor, because he was much loved in the community, and it was such a heartbreaking thing to see that it was unnecessary, really. That if Ken had, he was an intelligent guy, but if he had just pretty well done it 2 or 3 years, 4 years beforehand, we wouldn't be where we were. And of course, I went to the thing. I just cried my eyes out. I mean, it was so heartbreaking. He was such a great friend. And that's probably why I'm talking to you guys now, is just to try and encourage you.
No, it's hit you hard enough to make you want to make sure that no one else gets it. So
yeah, and that's why I do it. I'm not a virtuous, wonderful guy. It's just
Mm.
I'm a fellow human being.
Well, it's life experiences as well, isn't it?
Yeah.
You know, and you don't want no one else to go through that.
It's
Yeah.
a humanist. It's a humanist view. You know, you take
Mm.
away people's pain and you know, lead them towards their joy more than discomfort. It's a humanist thing. So why wouldn't you want to push people to go and
Well,
sort themselves out?
I can actually still see in my mind's eye, it's just up in the pulpit, with the massive congregation in the church and looking down at Ken's widow and his 2 sons and his daughter and what have you. It was just, so anyway, there we are. I'm a
Mm.
cheerful, aren't I?
Well, they could have had 20 years. They could have had 15 more years.
Yeah.
Yeah, well, I've
Yeah,
had, I've
you just
had 10,
listen.
15 years at least. Well, actually, this is the good news. My consultant said to me at the end of it, he said, look, Steve, you're not going to, you won't die of this.
Mhm.
Yeah. This
So
is
I
not
said,
what you're going for.
So I
That's
said,
the
what am I
relief,
going to
though,
die of? And I said, he wouldn't tell me.
Yeah.
But it was mentioned finally, after all this expensive treatment and all these weeks of doing it, I'd finally walk out of his consulting room. And they don't say you're cured, you're never completely cured. But I've been down a long and interesting path.
So what happens if you have an enlarged prostate then?
Uh, well, I think there was that bit at the beginning, which I'm not entirely happy with in the presentation, but there are other things
Mm.
that cause the prostate to be enlarged or to be painful or to make you pee, which aren't going to give you cancer. So that doesn't answer your question, but that's all I can say. I don't really know.
Right, so an enlarged prostate isn't necessarily cancerous then?
No, there are certain problems you can experience with the cancer, which isn't going to kill you.
Right.
But cancer does, as I'm afraid I've told you about 1 million times this evening.
Mm.
I think you got the message by now, have you?
Just about, yeah, just about.
When they diagnosed me with diabetes way back in the early 20s, it's like, okay, so what could happen? And they listed all this stuff. And when it comes down to you may lose, you get erectile dysfunction, I was like, whoa, what can we do about this? No, I'm all ears. Let me get off there now. Hold on. Let's talk about it.
That got your
Let's talk about it.
interest.
Yeah, and so now when men, especially black men, talk about prostate cancer, they don't want to approach it because they think, oh, if I go to the doctor, he's going to say, I've got it, I won't be able to have sex anymore. But if I just keep it to myself and avoid that, I'll be able to have sex. It's some ridiculous way of thinking. You see what I'm saying? But if you have it removed, then you got that problem. You haven't got that problem. You can continue to have your sex life. You see what I'm saying? So it's one of them things where you have to. Yes.
Well, can I just say that you're a very wise man, and it's nice to hear from somebody that's looking at it sensibly. No, it's true. But but actually one of the things, because I've given these talks in groups over to Airbus in Stevenage. There's a mixed group of stuff, and there's a bunch of younger people and older people. And I said, well, if you're worried about getting erectile dysfunction, you young guys, just go and have as much sex as you can now. But
Yeah, real talk.
but that didn't go down too well with some of the ladies in the audience. But it's not everything. Ultimately,
people need to ask more questions to get it off their chest and find out exactly what's going on. And
Yeah.
people like you doing these kind of talks and going around to as many places as possible. This is why you got your test and got it sorted, so you can do this.
Yeah.
You are required.
Thank you. Well, I'm glad I'm required. Well, I said, I'm not a virtuous sod. I'm I just like people, really.
There you go.
Okay, any more questions? We're about to wrap up now, guys.
We're better wrap up. Anyway, this went on a long time. Fill an hour.
Yeah. So let me just see. Any more questions? No.
Okay. Well, can I just thank you for giving me the opportunity to talk to you guys and to meet you all. That's great.
Yeah, no worries. Thank you for popping by and having a word with us and letting us know.
Yeah. Well, if you want me back again to apologise or whatever I need to do.
Thanks.
When's your next talk? Is it for black men?
I haven't got anything scheduled. They just come up as when people ask. So if you ask me, I'll do one.
Okay. Do you think it should be mandatory?
I think so.
Do you think the testing should be
It
mandatory?
should be. I think so. Yeah.
I think they should be when they are reliable. That's the official line.
Okay, you're sticking with that, yeah?
Well, that's all I can say. I'm sorry.
Why
But,
should women just have a breast screening and we can't have nothing? Well,
All right. Careful of the toxic masculinity now, yeah?
you know what I'm saying? Toxic femininity, they get a breast screening, but we can't have a
Well,
breast.
yeah,
prostate.
but that's because the breast screening test and what's the one that
It's accurate.
It's accurate.
yeah, they are accurate.
Cervical cancer smear test.
Mm. All right. Well, again, thanks a lot, Steve,
Okay,
for
mate.
popping in. Much
So should I
appreciated.
sign off now then?
All right.
Thank
Take
you
care.
very much.
Cheers.
Okay.
Thanks.
Thank you.
Talk to you
Cheers,
again.
mate.
Bye, everybody.
Bye, mate.
Take care.
All right. Bye.
Bye.